Welcome everyone to Unsaid. I'm your host, Catie Whiting, and we have a super cool episode today with the fabulous Katy Poole, Katie and Katie, who is a
Yep.
family nurse practitioner and a fertility consultant here in Chattanooga, Tennessee. And Katie's coming on to really help us bring a conversation on this show to infertility and even down to IVF. I have a lot of mental health patients that go through this, and we, even as providers, can always learn more for sure.
Mm.
And we just have a lot of individuals out there with a lot of questions. So, Katie, welcome.
Yeah, thanks so much for having me. I'm looking forward to this.
Yes, it'll be fun. Yes.
For
So,
sure.
let's just jump in. And from your scope, what is infertility? Give us a good definition of that.
Yeah, so technically, infertility is defined as not getting pregnant with 1 year of not using any protection or birth control under age 35. So you got to try for a year. And over 35, that shortens to 6 months. So if we've gone 6 months with trying to conceive over 35, then that's technically a diagnosis of infertility. Mm-hmm.
Okay.
Yeah, sure.
But
Yeah.
definition of infertility. So, tell me why individuals come to you.
Yes. So I kind of have like a couple of demographics. I would say the first demographic is the people or the couples who have been trying for a while. They have not gotten pregnant, and either they're going through IVF and kind of want to prepare better
Yeah.
and get better outcomes because there is a way to prepare for IVF. And so I help kind of people in that transition.
Yeah.
And those people who maybe don't want to go through IVF, and that's what they have been told is their only option, is another kind of big client demographic that I have.
Yeah.
And then I also see people who are just like, hey, I'm just about to try getting pregnant. I've heard that my friend or my mom or so and so has had a difficult time, and I don't want to do that. Like, let's
Yeah.
go ahead and start working on the front end so that in a year from now, if I still haven't gotten pregnant, like we can really have a lot of good information and really know what trajectory I need to take, or ideally not. Like ideally, if we get on board and we get everything planned on the front end, we don't have to go that infertility and IVF and
Yeah.
additional workup route. But it's kind of like let's catch things before you've tried for a year. Let's catch things on the front end so that we're not looking 3, 4 years down the road and just now going through IVF or doing whatever the journey takes you.
Yeah, absolutely. So I thank you for that definition. So, I mean, there's three segments, right? But like, it doesn't
Hmm.
have to make it to the year without conceiving or the 6 months after 35. We can come just in preparation of like,
Totally.
hey, help me make sure all is well, which would be what? Like, let's take it segment at a time. That would be egg
Hmm.
quality. What
Hmm.
what else are you looking at for someone who's getting ready to start a family?
Yeah. So if someone is just coming to me and they are like, hey, I want to have a kid in the next, or try to start trying to get pregnant in the next 6 to 12
Yeah.
months, what we're going to do is some like baseline lab work. We're going to make sure that the things that I see that are associated with recurrent miscarriage, the things that were associated with infertility, we're going to start checking those off now. Like if you've got signs of endometriosis or PCOS, or you've got abnormal cycles, like we need to address that on the front end. There are also certain lab values that I want to look at. So, for instance, a low vitamin D is associated with recurrent miscarriage. So, if we've got a client who has a low vitamin D level, we want to get that vitamin D on board and we want to recheck it and make sure that that level is at an optimal level to prevent the, recurrent miscarriage or complications. The other thing that I do is to help people improve their egg quality and sperm quality because it takes 3 to 4 months to change egg and sperm quality. So we want to start that ASAP. So if you're thinking about trying to conceive in 6 months, and ideally I want those supplements that we know have been proven to improve egg and sperm quality, I want those on board for 3 months because when you start really trying in 3 months, those levels are going to be at an appropriate value. Those eggs are going to be the highest quality. That sperm is going to be at the highest quality. And so we're going to increase the chances of getting pregnant more quickly. We're going to reduce the chances of miscarriage. We're going to reduce the chances of needing, IVF or any sort of additional reproductive endocrinology assistance.
Okay, that's awesome. Absolutely. So then let's jump to segment two, or I'm calling it
Yeah.
segments. But so now we're 35 and we've had a year without conceiving, a year of trying without
Hmm.
conceiving. They come to you. What happens?
Yep. So if it kind of depends on what they've done so far, right? So
Mhm.
each person is totally different. I've got some people that really like have a plethora of lab work and we'll
Yeah.
go through that. And I've got some people that are starting from zero.
Okay.
So a lot of times we'll get like a semen analysis too, just
Yeah.
to kind of get a baseline if that's never been done before. And we are starting to be like, okay, well, why haven't we gotten pregnant in a year? So we're going to probably start with things like a semen analysis, again, lab work, looking and see what's going on. And that might mean we're going to start having conversations with an OBGYN to start looking at ultrasounds, to look at anatomy to see are we having other like anatomical issues as to why you're not getting pregnant. Because if people do have like a Fallopian tube issue, well, that's going to be a different trajectory on how you're going to get pregnant and stay pregnant. So we want to kind of rule out any sort of like big overlying problems that could be present because we want to know that again on the front end. We don't want to wait until you've been trying for 3 years to find out that both your fallopian tubes are blocked. We want to know that at the beginning. So we work together to kind of advocate for yourself and ask your OBGYN, hey, I've been trying for a while. I've done all of these things. I'm still not pregnant yet. How should we start working this up further? And so I kind of help my clients advocate for themselves to get those tests ordered so that we can review them and get them checked off and then go to the next step.
Yeah, absolutely. And tell me if you're comfortable with this question. Like, why is that not an automatic when I go to my OBGYN?
Yeah. So the process is going to be different for depending on your provider,
Sure.
depending on your age, depending on how aggressive you want to be.
Sure.
And so, like for my personal background, I was told, hey, I've been trying for a while. And for me trying, I was like a psycho to begin with. Like I'm peeing on a stick. Like I am
Yeah.
knowing my fertility days. Like I'm not just going here like willy nilly. Like this has been very planned for 6 months. And they were like, well, maybe come back in a year. And if things still aren't going on, like, then we'll maybe work it up. And I was not offered to like have any sort of imaging done. I wasn't offered to have any sort of workup. It was just like straight to IVF. And I was like, well, we don't really even understand why I'm not getting pregnant
Yeah.
first. Like I kind of want to understand that before I'm fast tracked to go spend, $30,000 to $50,000 and I don't have insurance to cover this. So, I think a lot of times if you advocate and you know what questions to ask and you have a rapport with your provider, you can get some of that done that's better covered through insurance and avoid having to wait for a longer period of time and kind of like get that through your healthcare provider that you
Yeah.
probably are already seeing, like for your pap smear, and just for your annual exam. And so if you kind of start asking those questions, a lot of times we can get that information sooner and you're not having to go to like the REI physicians to get some of that workup done. But it's just there's not a great standard of care. There's not a great protocol for it between like the OBGYN and going to the IVF clinic. And so you can kind of get more out of it. And that's what I help people do when we get to that point.
Yeah, no,
Yeah.
absolutely. No, that's wonderful.
Yeah.
That was a great answer. So I mean, let's go to part three, but
Yeah.
just for an overview, like, so we get to at what point in the infertility, and I'm going to use ignorant language, so you help me, but like, at one point, once someone comes to you and they're considered infertile and you're working the
Hmm.
infertility challenges, do we send them to IVF? And I'm coming from
Yeah.
your scope versus good old
Yeah.
Western med.
Totally. So I kind of, again, meet people where they're at. I've got some people who are just like, I want to do IVF. That's like my goal. And so
Okay.
my job is to kind of say, okay, if your goal is to do IVF, my goal is to help you get the best outcomes. My goal is to help you prepare to choose the best provider that's got good ratings and has good data through the CDC. My job is to help make sure that you understand what questions to ask, like what would happen to my leftover embryos, or where do you store these embryos, and are you open on the weekends, like helping you navigate that portion of things, and also working on the health perspective. So if we do have prediabetes, if we have some signs of inflammation, if we have PCOS, like we want to get your kind of underlying health as tight as possible before going through that process, because it is a pretty long and rough process.
Yeah.
So I want you to be and have your body as prepared as possible, because what I don't want to happen for those people that go through IVF or they think that that's kind of where they're at now
Mhm.
is that you go through the process and you don't get any good eggs or you don't get any good embryos, because that's very devastating.
Yeah.
So I want to help people on the front end so that we get the most embryos so that you have the most success with IVF. And I also help people do their shots, because I've worked with clients who literally have lost tens of thousands of dollars because they mixed their shots incorrectly or didn't read the directions properly, and they're not nurses or nurse practitioners. They're
Right.
not used to giving themselves shots. So I make sure that my clients are comfortable doing that side of things. And then we're talking through the process too of like, okay, here's what your embryo showed. This is what these numbers mean. Like, let's really understand what you're going through, what your body's doing, what these outcomes are, so that you have some control or feeling of control during the process. Um, and then for those people who are not wanting to go the IVF trajectory, we're going to talk about all options that are available and kind of looking at those results. Okay, well, if you do have two blocked fallopian tubes, IVF is really the only way that we're going to be able to get you pregnant. And I'll have those conversations with people. And sometimes it's very difficult to say, I really don't think that this is going to happen for you naturally. I think that IVF is going to be your best bet. And here's why, too, because a lot of times people go in, it's like, well, okay, time to do IVF and you don't understand why. And that would be incredibly frustrating to me. So, kind of like the educational piece and advocacy piece and knowing what questions to ask your provider is kind of how I'll help those people who are maybe don't want to do IVF or are pursuing IVF.
Absolutely, absolutely.
Yeah.
That's wonderful. So you can, I mean, I guess you can't necessarily slow what they're doing down, but you slow down the process so that they can hear all the in-betweens and have really empowerment to
Yes. Because when you
understand.
Yeah, because I mean, if you go to a doctor's appointment, I think that you remember like maybe 20% of the things that are said, right? And if you're getting like some shocking news or news you weren't anticipating, or you're in a state of stress, then you're not going to really hear a whole lot during that 10 to 15-minute appointment.
Absolutely.
So, my goal is to kind of help you understand what these words mean, help you take it from like big medical terms to like layman's, normal people
Yeah.
language and understanding, so that you can again make a good educated decision on what you want to do and what this means and how you want to proceed.
Absolutely, absolutely. And I should have, now that we know the overview, like I want to really
Yeah.
hone into infertility and IVF. But tell us even, and I should have asked this before, what is IVF? Like, what does it mean? Give people a synopsis who have no idea.
Yeah, so IVF stands for in vitro fertilization. And what that means is that they will take the egg surgically from the woman. You take a bunch of hormones, you get all these shots, and they kind of plump up a bunch of follicles. And so follicles are the little house that holds the egg. And they plump all of these up and they go through, they put you to sleep and they remove those eggs transvaginally. They go in, put a needle in, aspirate from the ovaries and get those eggs out. And then they fertilize them with sperm that has been kind of cleaned up and assessed. And a lot of times they'll look and see like which one are the best sperm, which one are the highest quality, and they kind of put them together and then they watch the embryos form. And then what you do is you let those embryos form over the next like 5 to 7 days and you watch how they grow. And the embryologist is the one who's going to look at those embryos underneath a microscope and kind of grade them and say, this is kind of our best looking ones based on the literature. These are kind of like class B and these are class C. Now you can use a lot of those, but they're also going to discard some that they're like, these didn't grow and develop properly, or these just don't look good. And most people now will also send it out for genetic testing, which just kind of is a one step further where they'll take a little cell biopsy and make sure that there's not any like large genetic abnormalities. And this takes a while. So once that all gets approved, then you prep your body for the embryo implantation. So that's not as big of a deal or as big of a procedure. You don't have to be put to sleep for that. And they'll place the embryo in, and sometimes they'll add medication or extra hormones, just depending on what your history and labs and ultrasounds are showing. And then we just insert that embryo and see what happens. So you kind of want to make sure that your endometrium lining is thick enough. So we go through all the stages to prep for that, and then they implant that embryo, and then you take a pregnancy test, a week to 10 days later, and see what it shows, and kind of go from there.
Absolutely. Absolutely. That's
Yeah.
wonderful. And so I know that this can be what I'm going to ask next, layers and complexity, but from your practice, your scope, when you're walking along the journey with someone with IVF, like beyond, I mean, you said advocating, right? You're giving them education and knowledge for the in-betweens. Are they also doing functional things with you, or how does that look?
Yes. So like certain supplements, and I'll always tell you too, like, hey, run this by your OBGYN or your REI doctor. Like make sure that they're okay with this too. And sometimes, I'll send articles like, here's why I think you should be on this. Like, here's what the evidence shows. Like, if we get any kind of pushback, like, I really think that you should be on this, and here's why. Like, let me send you why.
Yeah.
So yeah, I do work with people from that side of things too. And that's again where it comes in to be more helpful to be seen 3 months prior, because that egg quality and sperm quality takes 3 months to get there. So ideally, we want to start kind of at the beginning of that process, because it takes a minute to get those eggs where we want them to be.
Yeah, absolutely. Okay.
Hmm.
So, coming from the mental health perspective,
Hmm.
it's quite the journey, at least that I've witnessed others go through. So give me a little bit insight into whether it's your own journey or the journeys you've seen, what emotionally and mental health wise this does to women that you've seen in your practice.
Yeah, I think no matter where women fall kind of in their um, journey of infertility, it's incredibly stressful.
Yeah.
I mean, it feels like another job. And oftentimes, as women, we hold things in and we don't want to let others know that there's a problem, whether that's at work or even with our, spouse or our partner in who we're trying to have this child with. And so I see a lot of like isolation. I see a lot of like internalization of what's wrong with my body? What is going on with me? Am I not really a woman if I can't have a child? What does my life look like if that means I'm not going to have a baby? And it can spiral out very quickly. And so I always recommend that people work with a counselor because infertility is challenging, miscarriage is challenging, navigating your, marriage or your relationship during all of this is really challenging, and it can be very heavy. And so I think that everybody's kind of in a different place. It could be that you've been trying for 3 months, or it could be that you've been trying for 3 to 5 years, and it's still just very heavy no matter what, because you can't see what's on the other side. You can't say, I know if I keep pushing through this for the next 6 months, that I'm definitely going to have a baby by the end of this. You just don't know. And that unknown is very frightening for a lot of clients and people and colleagues and just anyone that that's going through that.
Yeah, absolutely. Absolutely. So the same question in a way, but like for individuals, partners, right, who are going through the journey as well, but not necessarily all of the medical intervention, what do you see with them, or maybe what advice do you have for them as they attempt to support along the way?
Yeah, I think open communication is very helpful.
Yeah.
I think if you let your partner in and be like, hey, this is giving me anxiety. Hey, this is
Yeah.
making me upset. Hey, I feel this way when I'm, seeing another negative pregnancy test, and just like informing them, because I know my husband was clueless, like was like, oh, I didn't even know that we had an appointment with the IVF doctors in a
Yeah.
couple of weeks. Like it was just, he didn't know because I didn't tell him, right? Because that was me and I was holding it all in and I was the one that was like taking all of this on. And I think that like learning from my past would be to let your partner in on some of that. You don't have to burden it all on your own. And I think too, another point that I like to make for couples who are struggling is to prioritize dating, like prioritize getting out of the house and remembering why you like to be with one another. Remember why you want to procreate with one another. Like it can just become such a heavy cycle of like, oh, here's my fertile
Yeah.
days. Like, here we go again. After that goes on for so long, it's just like, this is not as fun as it used to be, right? So making that priority to like plan a date night, making a priority to enjoy doing the things that you love to do together, I think are really important, especially during that time of your relationship, because you can lose that.
Absolutely. Absolutely. There's so
Yeah.
many, I mean, there's always priorities, but there's so many things lined up. It's hard to, yeah, to stay on the path.
Hmm.
Okay.
Yeah.
So, and you've hit on these, I think, throughout what we've just gone over, but like when individuals come to you, what are their biggest misconceptions about infertility and IVF that you see?
Yeah, I think the first one is like, I just had no idea it was going to be this hard to get pregnant.
Yeah.
Like, we think we often are trained from, teenage years of like, oh, have intercourse, you're going to get knocked up.
Yeah.
So that just doesn't happen a lot of times. And if it does happen and that's what you want, great. So happy for you. But for a lot of people, that's just not the case. And so I think that a lot of people are really shocked because they can feel pretty healthy. They feel like, oh, my labs are good. Oh, I'm healthy. Like, I should get pregnant pretty quickly. But there's a lot of people who are on birth control for a very long period of time, and birth control will not negatively impact your fertility, but it can deplete you of certain like vitamins and nutrients and minerals that then can negatively impact like egg quality, right?
Sure.
So thinking about, oh, well, I've been on birth control for the last 15, 10, 25 years and now I'm wanting to get pregnant. Well, we have to kind of learn your cycle. We have to like figure out, is your cycle regular? Because when you're on hormonal birth control, we don't have a good understanding of what your cycle actually is. And so I think that that's a big one, is that I didn't realize that me being on birth control wasn't necessarily affecting fertility, but kind of took away from you being able to use that as a vital sign, looking at your cycle as a vital sign and saying, oh, I know that this is regular. I know that this is me. I know that this is my hormones. I know that this is when I ovulate. It kind of removes that indication of what's going on with your body if you've been on it for a long period of time. And then you're having to start over. It's like, okay, I've stopped my birth control here. It takes a few months for everything to kind of work its way out and for your endometrium to line again and get thicker so that we can have a cycle. So I think that's a big thing of
Yeah.
like how much birth control actually affects fertility. And they wish they had maybe come off of stuff earlier and started supplements sooner. Um, I think that the timeline is also pretty shocking for people regarding IVF, because you have to like get an appointment with the specialist, then you get some imaging and you get some lab work, and then you have to get ready for a time cycle. So if you're like, hey, I'm ready for IVF, it doesn't happen right away. You don't just like walk in and go get IVF. It takes some like preparation and getting, all of your T's and I's crossed and dotted, going through the insurance, like understanding that. Like it takes a while from the point that you walk into the IVF physician's office and to the point that you get that positive pregnancy test, because it takes a minute to go through all this and then send your biopsy or send your eggs out or your embryos out for testing, and to get those back can take a couple of months. So
Yeah.
it's not something that you just walk in and have done. And a lot of people think like, I'm going to get IVF and it's not next week, and they're shocked about it. So
Yeah.
that's the other thing that I think is a common disappointment, maybe, I guess. It's
Sure.
like, oh no, I thought that I was going to be able to start this sooner.
Yeah, yeah. It's just, I mean, I hear time, right? Like, I mean, and that makes sense. Like, like when I was a teenager and a kid, like all the movies I watched, like Knocked Up and things like that. Like, that was the unexpected. So you just sort of assume, right? Have sex, have baby, and not necessarily the case. With birth control, I hear that a lot just in conversations with friends and things like, how long should I stop birth control before I actually think I could get pregnant? And I know there's
Yeah.
a lot more to it. But if I hear you correctly, you're saying, yeah, especially if you've been on it for a long time, we need time to sort of almost re-regulate our system, get our egg quality back up. Is that correct? Like time is
Correct.
better.
Yeah, so I usually, if somebody's younger in their like mid 20s
Yeah.
and they are, okay, I'm thinking about having a kid and I want to have it soon. I think discontinuing your birth control 3 months ahead of time, like when you're ready, is appropriate. That gives you enough time to like see your cycle. But if you are, latter 20s or in your 30s and you've been on birth control, I would stop 6 months before you were trying to conceive, because by that 6 month point, we should have been able to recognize, is your cycle regular? What's going well? What isn't going well? We should be able to have some lab work to confirm ovulation. Like we would have enough information to make a better decision. And then it gives you some time to try before doing anything additional. So usually I'll tell people about 6 months, stop your birth control from before you want to get pregnant.
Yeah, absolutely.
Yep.
Okay. Okay. So to you, Katie, like why did you get into this niche, if I may, and start your own business and really be an advocate and an educationer to these women?
Yeah. So, personal experience. So, my background is I was a nurse for 5 years in pediatrics, love that. And then I was a nurse practitioner, or have been for the last 10 years now. So, when I was struggling to get pregnant, around that time, I'd also started a doctoral program at UTC. And I was just like, wow, there's so much literature out here about being able to get pregnant. And I, even though I was a nurse practitioner and well educated and took a women's health class and helped deliver babies, I had no idea that was just not part of our education. And so when I went to my midwife at the time and I was just told, hey, maybe like lose 5 pounds, stop drinking Crystal Light, and we'll see you in a year and kind of go from there. I was like, that's the only direction that I'm going to get, is stop drinking Crystal Light. Like there was no lab work, there was no understanding. And then it was like, oh, a year later, you've been diagnosed with unexplained infertility and we're going to go to IVF. And I was like, whoa, like that just seems like such a lapse in healthcare. And I totally get it, right? Because as a provider, you are walking in the door and you've got 25 to 30 patients. You're diagnosing breast cancer, ovarian cancer, miscarriage. Like you are dealing with some very heavy things. You're delivering babies and you just don't have the time. And you're not also financially reimbursed through insurance to have this worked up. And so I was like, there are so many people like myself who fall into this unexplained infertility. And there was no education to me about like, oh, you do have endometriosis. Like, oh, that could be part of the problem here. Or, hey, your cycles are irregular. This could be part of the problem. There was just no education on that. And I was like, this is a huge demographic of people that look like me and have the education like me or a background like me, or are just women who want to know what's going on with their bodies and they're not given any sort of direction, right?
Yeah.
And so I felt like it was a great place to help people who needed help because it was just a huge demographic. I also, at the same time, my best friend was freezing her eggs and she was FaceTiming me at like 10 o'clock at night, like, hey, it came with these 2 shots, but it says I only need this much. Like, I think I'm doing it wrong. And this is all going on at like the same time. And I was just like, what in the world? Like, let me send me those directions. So I was like watching videos real quick on like how to pull up these certain meds and what to kind of look for her. And I was just like, oh my gosh, the education of this is so poor, because she was told to give herself like 1 shot, but really the vials were too small. So she ended up having to pull up and give herself 2 shots, which is just bad. So I just saw a huge lapse that women in this demographic were not being cared for in a way that I would want to be cared for as a patient. So giving some attention and some education and some understanding of what's going on with your body. So that I just started pivoting and started doing a bunch of research and started getting into more like functional medicine things and understanding like the root cause, because the diagnosis of infertility or of unexplained infertility is kind of infuriating as a patient and as a self. It's like, I just don't know what's going on. So I just started pivoting and diving into research and helping out friends and helping out colleagues, and realized that this was something that I wanted to do all of the time and use my background in education and empathy that I had towards other people in the same space
Yeah.
to kind of get them through this, what can be a pretty rough patch.
Yeah, absolutely. No, that's beautiful. It's always a passion project, right? That goes, we really need it. We really need it for sure. And I appreciate it. So, one thing that, I've done a lot of Western medicine for good reason, to get research done, to get things out there. There's a box we've been put
Hmm.
into, especially as women, but I don't want to disrespect the box as much as think outside of it as well, because there's so many beautiful things that come out of Western medicine. I can go
Totally.
on and on with my children and myself, but so if I hear you correctly, you're able to sort of look at both, right? The functional side and more of, the Western medicine side, and piece it together, because do you sort of believe it could be a whole picture process versus one or the other?
100%. So I've got like a
Yeah.
good kind of like story, I guess, or like kind of
Yeah.
a good example. There are a lot of people that have like what we call hypothyroid. So you may be diagnosed with hypothyroidism. You can also have what's called subclinical hypothyroidism, meaning by the terms that we have set in the United States regarding your thyroid function, if it falls between this limit, you're considered normal. However, some people are having symptoms and some people are having recurrent miscarriages, and they are having issues because your thyroid is not working properly. Now, there are some people that I feel like really need to be on levothyroxine. You need to be on a prescription. You
Sure.
need to get your thyroid controlled. Otherwise, you are more at risk for recurrent miscarriage. There are other people who have vitamin deficiencies and who are missing things in their diet. And so their thyroid is not able to function optimally. So if we can work on things to, in a more functional capacity, get some labs and understand better why your thyroid isn't functioning, let's do that for sure. If we can do that and just control it with like diet and supplementation, great. If we cannot, we need to bring in medicine and we need to use those two very closely. And I've had a lot of patients that end up having like Hashimoto's, which is an autoimmune disorder related to the thyroid, and they don't know that. And so we are finding that out. And then again, educating people on what they can do on their own. And then also pulling in endocrinology or PCP to make sure that those levels are being very tightly controlled and that we are getting the proper medical support in addition to nutrition and making sure that you're not depleted in certain things. So absolutely, I believe in marrying the two
Yeah.
together. I think that we need both. I think we need more research on how some of these supplements work because there's just not a great database for research, and a lot of times we're kind of having to piece things together. I have a ton of books and I have a ton of like ways to look things up, but sometimes you end up with the functional medicine stuff like I just don't know.
Yeah.
And so I think that there's a lot more room for research too to kind of blend the two together and help support people in both ways.
Yeah, absolutely. I love it. So for those, and it triggered me, Hashimoto's. I worked with a client that was going through IVF, has
Hmm.
Hashimoto's, has all
Yeah.
of, but it's straight like, you know, here's your rheumatologist, here's all these things, but here's go get IVF, and it's just like its own island in a way. But
Hmm.
those more specific, like, and not everybody's in Chattanooga, right? That
Yeah.
that
Yeah.
listens, but those more specific, like, what, I guess, words of advice. You have those that are like they're in the thick of it, but they know they have there's autoimmune, there's inflammation,
Hmm.
all the things that come with it. Like, what do they do when they can't call you, or maybe they can call you, but are you
They can certainly come. I
okay?
can see patients wherever. Yeah. So
Okay.
while I'm based in Chattanooga, I do everything virtually. So I
Okay.
very rarely like see people except if I like run into them at the grocery store
Yeah.
or at a concert. So I do everything virtual.
Okay.
I think you've got to find somebody who is like a really good investigator,
Yeah.
basically, like somebody like a primary care provider that you trust or an OBGYN that you trust. However, sometimes you're going to have to do your own research. Sometimes you're going to have to ask for things that you may get your eyes rolled at you. I've asked my physician for certain lab work, and he literally rolled his eyes at me and said, "This is very academic." And I was like, "Well, I am an academic. Okay, dude, like back off. Just order the labs. I'll pay for them. Jeez Louise." So finding someone that you trust, I think, is really critical. Asking friends, book an appointment. Like I do free consults for 20 minutes and we just like chit chat about your case and kind of let you know what I do. But I think finding somebody who can help you, get your cycle in check, who can help you really figure out what's going on. And that may be a nutritionist, that may be or a dietitian, that may be a pelvic floor. Like once you kind of start to understand what's going on, you're going to have to do some research and start advocating for yourself or work with somebody who has put in the work to really start figuring this stuff out, because it's a tangled web sometimes. Sometimes we've got like labs are out of control here, thyroid can be out of control, blood glucose can be out of control, inflammation is out of control, and you just have to have someone who's going to dig a little bit deeper and go to the next level when we find something that's atypical.
Yeah, absolutely. That's beautiful. And that's good to know because you're right. We're programmed for instant gratification. I mean, I go on Amazon and the package is to my door with 24 to 48 hours, right? So,
yeah,
but we need to, especially as women, right, slow down and really dig and find or advocate for a voice for sure.
Totally. Yeah. And I always recommend too, I think cycle tracking is really helpful for the purpose of knowing your body and having some data and just like really figure out what's going on. So that's another like not necessarily easy. It's kind of a pain to wake up every morning and take your temperature for sure and be like, okay, like let me pee on a stick and take these tests. But that kind of stuff can start giving you a hint of like, okay, is my cycle typical or not? Like, am I noticing that I'm ovulating based on my temperature spikes? Like, it gives you some information and things that you can physically measure and start paying attention to then be able to say, this is atypical and here's what I'm seeing and here's some data and what do we do about this next? So like starting at that point, when I work with clients, it's great when they've already had that, because if I can look at like the last 3 months of their cycle tracking, I can be like, oh, this looks funky, or this looks great, where, I'm more encouraged and not as worried about things. So that's one thing that people can start doing to like get some information and really start kind of taking some control over their body and their cycle when they are wanting to think about having kids.
Yeah, absolutely. And through all the phases I've been studying through this podcast platform, just like track your period. Like it is a vital sign. And nobody put that into perspective until last year for me. And it's so important to just have the power of our bodies. So I love it. I love it. So anything like, and you rocked it, right? We went right through those sections. Like anything else, Katie, that you see come through your door that we really need to like hone in on that would help just learn more, right? About infertility and IVF specifically.
Yeah. So I think one thing that's really interesting that's coming out and becoming more popular now is egg freezing. So I also take care of clients that are navigating egg freezing. And a lot of times the insurance, especially with some of these bigger tech companies and Starbucks, Qualtrics, Amazon, a lot of companies are now starting to have reproductive insurance. And I think that it's really interesting too, because those are also starting to cover some like IVF stuff. So I think it's good to be educated too about like if you're looking for a job and you're thinking about egg freezing or you're thinking about IVF or you're just thinking about your future period. It's like I don't know what I'm going to want or what I'm going to need. Looking at your benefits can be really helpful when you are trying to pick out a new job or trying to figure out what you want to do. Like I literally just had a client that switched jobs as a registered nurse to a different hospital system because they had what's called Progeny, which is a newer company that I've seen that has pretty good coverage for stuff. And so that can be something to start paying attention to as a young adult looking at jobs. If you think you're going to be a loyal employee and you're going to be there for 10, 15 years, you may want to start interviewing them too of like, do you guys cover any sort of reproductive insurance? What kind of benefits do you have regarding health and reproduction? And that has been a huge game changer, so much that I'm seeing people leave their jobs for it. So that's something kind of cool and on the upcoming medical side of things to pay attention to and to, prioritize maybe.
Yeah, absolutely. No, you're right. There's so many layers as there is for all of it, but it's important. It's important to just part of really knowing our space and knowing where we're headed. One thing I didn't ask, and maybe I did in a way, but there's so much, again, going through what I see, right, is there's just like women have described it as like being on an island by themselves, like just so
Mhm.
lonely through this process, whether it's just like they're in the year of just trying to get pregnant, whether they're going and they're all in IVF.
Mhm.
From your, personal experience, professional experience, do you see that? And should that be different? Like, is there something we're missing that we're not doing as providers out there, or women or communities to help?
Yeah, I think that women are so good at like confiding in one another and taking care of one another. And I think that if you have like a close friend or a close group of friends that you can confide in and let them know that you're going through it is really beautiful to tap into that, because people don't know if you don't tell them, right? And so definitely recommend people find somebody that they can confide in. And if they can't confide in somebody, find a counselor, find somebody that you can speak to and not feel so isolated, or who can kind of be a sounding board, or who can offer you some resources on what to do and how to manage it, because that is a huge thing that I see, that people feel so isolated and just don't know what to do or where to go. And so I think just having somebody to listen and understand and empathize, and not necessarily give you direction or say, oh, try this, or go to this IVF clinic, or try taking this one supplement that my aunt did, or why don't you try putting your legs on top of your head, or sit upside down for a while after
Yes,
intercourse. Like, you don't need somebody to kind of give you a
that's
bunch
right.
of poor advice. You just need somebody to kind of listen and acknowledge your struggle,
Yeah.
basically, for sure. So I think that that's a big thing to look for, and to know that it's normal to feel that way too. I've read or listened to, because I just do audiobooks mainly now, the Michelle Obama's biography, and she talks about how hard it was for her to take time to leave work and go to these IVF appointments while her husband is just like working, gets to live his normal life and do his thing. And so having a friend that you can have come to you with appointments, or having somebody that you can just kind of review everything that's been going on, I think is really helpful.
Absolutely. That was beautiful. And I want our listeners to hear too, if you are not the person, let's say in IVF, and you're a friend of, like just listening and validating and acknowledging, you said acknowledging, like so important, versus we are such an advice giving culture. Like, well, try this or do this. And it's too much. They just sort of want to be held and heard. And I think that's beautiful. I would love
Yep.
everyone to take that away.
Mm-hmm.
Wow, I've learned so much from you in 35 minutes.
Oh,
Nicely
good,
done.
good.
Katie, thank you so much for being on our show today. I've learned a plethora from you in 35 minutes, but tell everyone, and I guess this would be the United States then, how to get a hold of you, where to find you. We'll list everything in the description, but go ahead and tell us your handles and your website and all the things.
So my website's pretty straightforward. It's katiepoole.com. So KATYPOOLE.com. And then my Instagram is at Katie, KATY Poole, POOLE Wellness. So that's the easiest way. That's where you can get all my resources. That's where you can book a free consult, or just follow along for some kind of tips and tricks on what to be looking out for and what's atypical.
Yeah, absolutely. No, you're on point on your social media reels, lady. You are rocking, and I know it's a commitment. So you're kicking butt with it. But absolutely, if anything, we just need to follow you and learn from you. And then, yeah, I mean, what's the worst case? We book a consultation call, and it's not the right match. It is what it is. But it's worth asking questions. Like we've got to advocate for ourselves and feel better, right? Okay. All right. Well, we're so thankful to have you on today. It was always good to see you. And those listening, this is Unsaid. We're always trying to talk about the things that aren't talked about as much, even though they're becoming more and more talked about these days. So we'll see y'all soon.